Back home, and health authorities are working to dispel misinformation that the COVID vaccine could affect fertility, as vaccine hesitancy amongst young women continues to rate above the national average. In the latest in our Vaccine in Focus series, experts warn the lasting effects of contracting COVID are far more likely to result in fertility problems than having the vaccine. In a clinic east of Melbourne, Dr Stacey Harris says there's a vaccine question she's come to expect.
Can it affect their periods? Can it affect having a baby?
Her answer is always the same.
We're looking straight at science here. We're not looking at what politicians have to say. We're not looking at what media says. We're looking at the science, and the science says, and the studies now are robust, and they're showing that they don't have effect on fertility.
Melbourne Institute research showing women aged between 18 and 44 years are the country's most reluctant demographic to get the shot, but that could be changing.
In July, hesitancy was up to about 40%, but now it's dropped to around 25%. So hesitancy amongst women, particularly amongst women who want to have kids, has come down quite a lot.
Last year, after a small number of women reported changes to their menstrual cycles after receiving the vaccine, unsubstantiated infertility claims emerged online.
It's a disproven theory that's based on an idea around the spike proteins.
A recent US study of around 35,000 pregnant people found the mRNA vaccine safe for both parent and child, posing no increased risk of miscarriage or placental abnormalities, leading Australia's Vaccine Advisor Group ATAGI to recommend vaccination at any stage of pregnancy.
And the reason for that is because we now know from the data across the world that those who are pregnant are at greater risk of severe disease.
A message reiterated by fertility experts.
I say to every patient, you do not want to end up on a ventilator in the later stages of pregnancy because you're vulnerable to COVID, when you could prevent that by being vaccinated now.
With studies showing a COVID infection during pregnancy could lead to preterm labour and even stillbirth. Evidence also indicating potential fertility consequences for men.
It is clear that in men who have COVID infection, the sperm count in cases can drop quite dramatically. However, it's very difficult to know what affects long-term fertility.
While vaccine rates continue to rise across the country, around 20% of the population remain hesitant. Within that figure, 10% are considered hardline anti-vaxxers. Abby Dinham, SBS World News.